brief demonstration here of all the stuff I showed you in the previous video. This is Anne-Marie, and I just met her at our clinic today here in Lincoln, Nebraska. She came all the way from Finland, and she currently is in an old A623. This is her last pair. She's been looking for them on eBay because the newer version of the A6 Cumulus is too cushioned for her. She also does have an orthotic in here because she does have bunions. So that orthotic is, and she's also more flat-footed. So she does have an orthotic in here to help give her better arch support. And with the A6 Cumulus 23, and I'm going to have her walk towards you just to give her body time. And I'm going to show you an objective test with the ability for her brain to be able to feel the ground underneath that shoe. She's going to walk up and back one more time. And her brain's ability to feel the entire ground underneath that shoe is going to be very important to affect movement. So she's going to turn around and face you. And Anne-Marie, I'm going to have you pick up your left foot for me. Can you feel the ground underneath your right shoe, heel, arch, and big toe?
I can.
And then if you got on your left foot for me and picked up your right foot, can you feel the ground underneath your left foot, heel, arch, and big toe?
Yeah.
So we're going to go through objective tests. So we're going to lay her down here on the edge of the table. And these are all tests that PRI physical therapists do. So we know this is looking at the hip flexors. This is a negative test. I'm going to have Anne-Marie scoot up. And these are all objective tests that we like straight leg raises. Can you feel your hamstring? Between 80 and 90 degrees, feel your hamstring. And we do objective tests at the pelvis, the trunk, and the neck to make sure that the body, your neck can tilt to the left, it can tilt to the right. And Anne-Marie, if you disagree with any of this, you see how you have the ability to rotate your neck both directions? We're going to come up to the edge of the table here. Your arm goes down. All of these tests are negative in my world, demonstrating to me that Anne-Marie is in a good biomechanical position in her head, neck, and trunk. The last test we're going to roll over for me on your side. This knee goes down, tells me your pelvis is in a neutral position and not falling forward. Go ahead and come over here on the left side. Face them for me. And so all of these objective tests go away. So now I'm going to have her put on a different shoe. This is a Saucony shoe. And while she's putting on these shoes, I'm going to steal one of them. And again, it has the cushioning at the top, one layer of material, and it has a heel that scoops up. And when these heels scoop up, it's probably going to shift her body weight forward and make it hard for her to sense her heel. And remember, the importance of this heel counter helps the pelvis to stay upright so I can get power for my hamstrings and my glutes and not overwork my hip flexors or my back extensors. So when our patients do a PRI program, and we do exercises to help to provide more strength and stability and help the system at the head, neck, and trunk to be more stable and to build up strength so the body can move side to side and stay in a neutral state. If the minute my patient gets up and puts on a pair of shoes that doesn't complement that program, they're going to lose the benefit of all that hard work. So I'm going to have Anne-Marie walk towards this camera. And as she walks, it's not going to take very much time because her brain's ability to feel that ground underneath her foot, I'm going to bet, is going to change a little bit. Anne-Marie, don't let me mislead them. I want you to be honest with what you're feeling here. Can you tell that she's kicking a soccer ball when she walks down the hallway? So when you walk towards them, her hips cannot extend. Her leg cannot get back behind her. If she stands on her left leg, pick your right leg up. Can you feel heel, arch, and big toe on the ground?
No, it's like very unstable on my midfoot and toes.
So you don't feel your heel, you feel very unstable in your midfoot and toes is what you just said. And then stand on your right foot for me. And what about your right foot?
It is like shaking.
So do you feel a heel?
No, not at all.
And do you feel your midfoot and heel? So her body weight is shifted forward. When her body weight is shifted forward, that's what her brain feels. It's going to cause the pelvis to come forward. And now she cannot use the power from her glutes and hamstrings to push her forward when she walks or runs. So she comes back over here. We're going to do all of those same tests. And we're going to keep her knee bent. That's her hip flexor. That can knock it down to the table. So these shoes have put her in a position to overwork hip flexor. So now she's going to pull herself forward with a neck, a back, or a hip. They're going to come up here. We'll look at her neck. Her neck can still tilt to the left, but it cannot tilt to the right. Would you agree with me, Emery?
Yeah.
If I come down here, her neck can still rotate to the right, but that is a hard bony stop. It cannot rotate to the left. Her arm cannot come down and hit the table. Her ribs and her spine are not in the correct biomechanical position. She's going to scoot out to the edge of the table. This arm that could come down to my table is now up in the air. These are all positive tests, all just from a pair of shoes. And this arm cannot go down and hit the table like it could before. We're going to look at her straight leg raise. And now I can get over 90 degrees. When I can get over 90 degrees, her hamstrings are not in a position to provide support to the pelvis. They attach to the back of the ischium of the pelvis. So that's way too flexible. Hamstrings are powerful to help pull that pelvis back. Roll over for me on the right side. There's no way that's going to go down. And so her pelvis is not in the correct biomechanical position for her to get power from her glutes and hamstrings and her inner thigh. Lay down for me on your left side. And that's all from the qualities of a shoe that don't fit our criteria. Go ahead and sit up. So this is the power of the qualities of a good shoe that we talked about in the previous video. I just want you guys to understand the power that your shoes have with our program and the power that your shoes have with injury prevention. Thanks for watching.